All right, the technology works. Welcome. I'm so glad you're here. I'm Dr. Andrea Christian Parks. I'm a Christian, a OBGYN physician, and a wellness and weight loss coach for women of faith. I help women lose weight who want to stay in alignment with their faith and lose weight in a godly way. So, what are we talking about today? If you've been here before, welcome back. I'm glad you're here. And you know that we've been talking about GLP-1 medications and whether or not they can fit in a godly weight loss plan. Now, I've answered the question about if using medications, if it's cheating, if it's all, you can definitely go back and watch that video. Spoiler, it's not. But I talk about it more deeply in a previous video. So go on back, look through that if you have questions there. But today what I want to do is do some frequently asked questions about GLP-1s. I think this is going to be the last video I'm going to do on GLP-1s, at least unless someone has more questions. If you want me to talk about this more, please make comments, let me know, and I will create more videos to answer those questions. But for today, there's 5 big questions that I've seen over and over and over again. I'm hearing from people and I want to just answer them because I think to make the decision if you should be on a GLP-1 medication as part of your godly weight loss plan, you have to be able to answer these questions. And so let's get to that. I want to make sure to answer these 5 questions. And if you have more, please make comments, let me know, and I will definitely answer them. Okay, so what's the number one question that people want to know about GLP-1s? Well, people want to know how they work. Like, how is this different from something in the past? Like back in the days when we had fen-phen, or if I'm considering weight loss surgery, or, my doctor wants to put me on metformin, I'm pre-diabetic, or I'm diabetic. And, a lot of people say you lose weight on metformin. What's the difference between this and a GLP-1? Well, so how GLP-1s work is multiple ways, but it's a medication that is actually like one of the hormones that comes in your body from eating. When you eat, you get a chemical signal that says, I'm full. And a GLP-1 is actually a medication that gives that same feeling. So what that does is it makes you less hungry, so decreases appetite, makes you feel full sooner, and also reduces cravings and just kind of makes you stop eating so much at each meal because you just get full faster. So all of that works together. It helps people. And originally, this medicine was not created for weight loss exclusively. It was really created to treat diabetes. And so for people who are pre-diabetic, diabetic, this is a medication that was developed for that purpose. But they figured out as they started using it on patients that it also really helps people with weight loss. And the side, and I talked about this in a previous video, but I'm just going to say this, the other piece of what, was asked about in these what these people is like, well, if we're treating diabetes and it's working for weight loss, how much weight are we really losing? Like, how much impact is this medication having? And it varies. And that's something that really is important to know. Also, if you just take the medicine and don't do anything else, you'll get what we as physicians call significant weight loss. But that means 5% of your body weight. So isn't that interesting? What we consider to be significant really has to do with percentages and what most people will do without this medication. And so this medication makes a difference. It's bigger than what most people are able to do on their own. Well, that really just translates to 5% of your weight loss, which that might be absolutely what you need to lower your hemoglobin A1C and get out of the pre-diabetic range, or get out of the diabetic range down into pre-diabetes, and to go kind of backwards in that disease process. But it probably isn't enough to get you to your goal weight. And I'm going to get to who qualifies for this medication and why that makes a difference. Because if you just need to lose 5 or 10 pounds, you actually probably won't qualify to get a prescription from your doctor for this. So having said that, that's if you do nothing else, you just take the medicine, about 5% of weight loss. And then then what happens? How do these people lose much larger quantities, 15%, and that all depends where you start out. Like, what is your starting weight and where you're trying to get to? If you're trying to lose 50 pounds, 100 pounds, does that usually happen for people? With the medication alone, no. But with the medication and lifestyle changes, a lot of people are able to achieve 15% weight loss. Now, I have a client who I've been working with who is taking one of these medications, and she's lost just under 100 pounds. And so the difference for her is that not only is she doing the medication, but she's also doing the mental work that it takes to sustain the changes and to really change how she approaches food, what emotional triggers come up with eating, all that sort of stuff. We're working on all of that work so that her weight loss is not only significant, but sustainable. And so just so you know, doing the medicine alone probably isn't going to fix your entire weight loss issue and probably won't get you to your goal, but it will probably make a difference in your medical status. And for some people, that is enough. And if that's what you want, let me answer some more questions, because that will help you get to the place where you can decide whether or not you want to pursue a prescription. So the next question that I hear a lot is, well, are they safe? Is this medication safe? So the thing is this, the GLP-1s have been out for a little while, but again, they were used primarily for certain medical diagnoses, primarily diabetes. And so although diabetes is very, very common, the numbers of people who were getting this medication and trying this medication really, in the big scheme of things, are small. So now what's happening is you've got 1 in 8 Americans who've tried a GLP-1. So you've got this massive population of people who are trying this medicine. And some of the issues that are coming up because there's so many people trying the medicine. And so we're finding out more about it, more about what's working, what's dangerous, that kind of thing. So, the answer is yes, we think they're safe. And there's some things that are coming up that we're finding out are to be watched for. So what is that? For most people, the stuff that comes up, the side effects are very mild for the most part. They're not pleasant, but they're things like nausea, vomiting, and diarrhea. Because when everything slows down, hey, Aileen, when things slow down in the gut, people can have gut symptoms. So nausea, vomiting, diarrhea. They tend to be temporary. Usually what your doctor will do is start you at a lower dose on the medicine and kind of creep up until you get what you can tolerate, but also what works. So that helps decrease side effects. What is dangerous about a GLP-1? Well, there's 3 big things, and they're all gut related. The big one is pancreatitis. That's inflammation of the pancreas. That can be very, very dangerous and painful, and can be deadly, although it is very rare. Very, very rare. There's also 2 other things that are gallbladder related, which would be cholecystitis and cholelithiasis. That means gallstones and inflammation of the gallbladder. And so all of that, of course, related to your gut and how it works and processing of food. And so if you have a history of pancreatitis personally, you may not be a good candidate for a GLP-1. It just may not be a medicine that you should use. And then, there's kind of questions about gallbladder, things like that, whether people with gallstones or a history of gallbladder inflammation should actually take these medications. But the big one is the pancreatitis. So if you go to your doctor and you say, I would like to try a GLP-1, and they say, but you've had pancreatitis, I don't think this is a good idea. That's probably why. And because it is rare, right now, the data says less than 0.02% that have these complications with GLP-1s. That's really, really, really small. But again, the population of folks who are using this medicine or these types of medicines is growing, and that number actually might be low. We don't know yet. So it's important to know. Another question, how long do I take them? This is a big deal. You may need to take these for life. If you start, You either have success with taking the medication and you want to continue doing what you're doing. Some people, now there's this movement in obesity medicine to classify obesity as a diagnosis. And that means that then you can give medication to treat that diagnosis and treat it as a chronic condition. And if you do that, then you may be advised to take the medicine indefinitely. Well, do you have to stay at the highest dose? Or not necessarily. Most people at some point try to, drop the dose, come down with it. But it's unknown whether people who stop the medicine are able to continue to keep the weight off. The truth is most people so far are not keeping the weight off without staying on the medication. So does that mean don't take it? No, but if you think you're going to take it for 2, 3, 6 months and then stop, that might not work for your weight loss. The other thing is these medications are pretty expensive. Sometimes they're covered, sometimes they're not. And if you're paying cash, that's a long time to be putting that as a line item in your budget every single month to pay for this medication. So something to consider. All right, what else? Do I qualify to get a prescription? Right now, the way that most people qualify to get a prescription for a GLP-1 is 2 major things. You either have a body mass index over 30. That's just a math calculation between your height and your weight. You can Google BMI calculator and figure out what your body mass index is and figure it out. If it's 30 or above, you'll probably qualify with or without medical problems. Now, if your body mass index is 27 or above and you have a medical diagnosis, prediabetes, maybe PCOS, hypertension, heart disease, something like that, you'll probably also qualify for this medication, and then you can get a prescription. It doesn't really answer the question about getting paid for or not getting paid for, but it definitely gives you enough ammunition to get a prescription. Okay, last thing, where do I get a prescription? There's 2 basic ways. One is the one I recommend. I recommend you see your doctor, mainly because of what I was mentioning before. If you have certain things in your history, it really might not be safe for you to take this medication. And a physician needs to screen you and figure out if this is something that will work for you. And then you want somebody who follows your progress. So I do think it's best to go the route of seeing your doctor. Sometimes, for some reasons, that's not the way you want to go. The other option is there are some compounding pharmacies out there, online services that will screen you through a physician and then decide whether you qualify for the medicine and then provide it. Are they as safe as seeing your own physician who knows all of your medical history, can look at you, can check your blood pressure, can check labs? No, I don't think so. And that's why I don't recommend going that route. But that is an option out there. And if you look on the internet, you're going to find it. And that's why I'm going to mention it, because even though I'm not your physician, I am going to tell you, all of what's out there and whether it's safe or not. So that is all the questions I want to answer about the GLP-1s. I think the main thing to think about, like when you're trying to decide, is this something I want to incorporate into my weight loss plan as I try to seek God, as I try to treat my body like the holy temple that of the Holy Spirit that it is, as I try to honor God with my eating, is this something I should use? And I think you get to decide. I think medication, surgery are tools that we have at our disposal. I don't think they're sinful. I don't think they're something that you shouldn't pursue. But I think you want to make an informed decision and decide, what am I doing outside of the medication to really build a plan that honors God with my body? What am I going to do about my food? How do I deal with emotional eating? What do I do with stress eating? How am I going to undo some of the patterns that I've established from many years of eating the way I've been eating that have caused me to be overweight? That's the real hard work that has to be done. And that's what makes weight loss permanent. And that's how we honor God with our bodies. So not to be a perfect weight, but to eat in a way that honors God, to stop eating when we're full, to really listen to the signals that God has put in our body to tell us when we've had enough. So, all that being said, if you want more help, I want you to be able to go to my website, definitely read my blogs, read articles. You can go to my YouTube channel, binge watch all these videos that I've been doing, and get support. If you want personal support, you're like, nope, I already know, I've been doing this. I need somebody to help me. I'm here. If you go on my website, you go to calendar, you can book a consultation and let's figure out how we can work together. I love y'all. I'm grateful you're here. Thank you for being here, and all glory be to God in all of your efforts to lose weight and honor him with your body. I'll see you next time. Bye, y'all.